53-year-old Canadian asthmatic diagnosed when I was 2. I have been on just about every med that's out there. Currently, I take 7 meds on a daily basis, not all just for asthma, also for comorbidities. And I also have 3 rescue meds that I carry with me almost all the time. I am, for lack of a better term, pharma's wet dream. Now, that feeling is not mutual. And let me tell you why. I didn't cause my disease. It's not something I did because of lifestyle. I didn't smoke in the womb. I just have a disease. And what really gets to me is that pharmaceutical companies continue to get what's known as, in economics, as supernormal profit over something that I don't have a choice in. I have to take these meds to stay alive. So, why am I here? Last year, sorry for the pun, but really sucked for me for asthma. I had 2 ER visits, one by ambulance. But it made me rethink what happened or is happening with my asthma. So I tried everything. I did every test I could. I even flew from Halifax, Nova Scotia to Hamilton, Ontario to spit. So one test that we didn't have at home. The irony is I got there and I couldn't create a sample. But I did change my drugs. I changed from dry powder inhalers, excuse me, to meter dose inhalers like this. This one in particular, QVAR, people were raving about it. So I tried it. I took it home, I looked at the box, and I just couldn't believe what I was reading. Beclomethasone dipropionate. I took that over 40 years ago. It was developed before I was born. Why did I just pay brand named prices, well, 95 Canadian, it's not much, 200 American, for a drug so old? Well, what it comes down to basically is evergreening. What pharma will do is they'll take a product and they'll tweak it. They'll make it long-acting. They'll change the formulation. They'll change the propellant. They'll change the case that it's in so that they can continue to push the patent as long as they can. And this is basically what happened with QVAR, although there's another backstory that's way too long to talk about. But when you take this and something like what happened with the EpiPen, you have to start to think about what is going on. Will this continue? Can we do this any longer, this kind of pricing? And I started to think, is this the beginnings of what is essentially the subprime crisis in pharma? So one of the things that I did, I originally got here because I decided to pitch the idea of a sort of a generic inhaler device that you could refill and reuse. But throughout that, and I apologize for the cough, it's part of asthma, I started to change my perspective on this and think about what I would do with these things. What could I do beyond what are coming out now called smart inhalers? And they're supposed to improve compliance. But the cynic in me said, no, after I looked at all of this is just more evergreening. It's the same thing happening over and over again. You've got proprietary platforms that don't talk to each other. How many of these am I going to need? One for each? Am I going to have to pay for that? What's going to be the cost of these? And it basically would repatent these drugs all over again. And some of them really were interesting. This one is based on actuation. Well, look, I just complied, but I didn't get any medicine. So that one's a little stale. This one's cool, really sexy, lots of buttons, and it's electronic. You can't change the battery, so it's built-in obsolescence. This is my favorite one. I call him Mr. Beefy. If there's one thing you can take from this talk for asthmatics, stop giving us crap to carry. But the most glaring thing about this is that it didn't do anything about outcomes. And that's what we're after. It just counted how many drugs am I getting better? I don't know. I'm taking lots of drugs, it's great. Excuse me. So, I know there's people with insurance in the room, and I was trying to think about how I could talk about this. And you're probably wondering, what's this Canadian got to say? He's got insurance. He's fine. Well, actually, the Canadian healthcare system, a lot of people don't know this, including Canadians. We don't cover drugs. We have a system just like yours for drugs. If you're poor, elderly, have a decent job, you're covered. If not, you got luck. 10% of Canadians don't have access to insurance. So when I started thinking about that, and I started thinking about where insurance is going, and I think we've identified today that there's a disruption coming. And certainly insurance is trying to get ahead of this by looking at things like value-based insurance. I started saying, well, would something like these smart inhalers help out? Well, value-based insurance is supposed to be based on outcomes. I've just shown that so far, that's not happening. Excuse me. The other thing I wanted to say about insurance is the value-based insurance is actually also predicated on the idea of incentives, incentivizing doctors and everybody to create better outcomes. Well, I'll let you in on a little secret. You cannot give my doctor enough. You cannot incentivize them enough to change my behavior. So I said to myself, well, if you're trying to incentivize things, why don't you incentivize where you want the change? Sort of a compliance-based funding. And you already do this in the US. Social Security can deny a disability claim if you're judged to be non-compliant. So thinking about this, I said, well, what if you really thought outside of the box and said, what if we pay the non-compliant to be compliant, to take care of themselves better? And we've actually seen this happening. If you think about all of the cities in the Midwest, and in Canada, by the way, where what they've done is they've saved money and taken care of their homeless problem by giving the homeless homes. You can apply that same thinking to getting non-compliant patients. So, I'm still working now on where I go with outcomes-based smart inhalers. I've given up on the compliance ones because I've just proven to myself, well, they don't really work, but we need the outcomes-based ones. So I'm still doing things. If you're interested, please talk to me. But I wanted to leave you with one thing. When I think back to what we talked about in terms of this disruption happening and the costing of drugs, I'm wondering if we need to be asking the question whether pharma needs to get out of the business of knowing how to game the system to get money and actually creating drugs that me as a patient would need. Thank you.